My name is Dr. Caroline Methi, an internal medicine physician, diabetologist, and endocrinologist.
Define the importance of nutrition when managing and preventing diabetes.
Nutrition forms the cornerstone of diabetes management, especially type 2 diabetes. And this is because we are trying to bring down the level of glucose in your body, and majority of the glucose is from what we eat. And so today we're going to talk about nutrition in the management of diabetes.
What role do carbohydrates play in managing blood sugar levels for individuals with diabetes?
Most of our food that we eat have actually glucose in them, but the major one is carbohydrates. We have forms of carbohydrate where we have processed carbohydrates or unprocessed or whole carbohydrates. In diabetes, we recommend that you take whole or unprocessed carbohydrates, and these carbohydrates include things like wholemeal bread, wholemeal grain, unprocessed ugali flour, and other root carbohydrates. Examples are ndumas or arrowroots and cassava.
How can meal planning help people with diabetes maintain stable blood sugar levels?
So meal planning is one of the essential ways to medical nutrition therapy. And in this, you're taught how to portion your plate, in the sense that half of your plate will be vegetables, and then we have a quarter of your plate will be the unprocessed carbohydrates, and then the rest quarter of your plate will be proteins. The other easiest way to portion your plate will be a feast for your carbohydrates, will be the palm for your proteins, and then the rest half of your plate will be vegetables. So that is an easy way to portion your plate.
Can you provide some examples of diabetes friendly breakfast, lunch, and dinner options?
We're going to talk about some diabetic friendly food in terms of your breakfast, snacks, lunch, and dinner. And this is an example. Feel free to explore as per your sugar diet or diabetic diet. So, for breakfast, an example will be having oats, and that will give you your carbohydrate, it will give you part of your protein. You'd need a protein, and this will be a boiled egg. Will be one or two. If you're taking two eggs, you remove the yolk and you take the white part, which is protein. And then you have your vegetables. It could be a salad or it could be some greens left over from your dinner. For snacks, some healthy snacks that are recommended, that's around 10 a.m., will be a green apple and a handful of nuts. Then at lunch, you'll have a protein. This will be either plant protein, things like beans, peas, green grams, and then you'd add on your vegetables. Key to note is that these plant proteins also have starch in them or carbohydrates, so we call them starchy proteins. And so when you're having that, we ask that you skip the other carbohydrates like your rice, or you put very little and have that with the vegetables. Animal proteins are a good option together with your vegetables. For 4 o'clock, you can have a fruit, still either an apple or a handful of nuts or unflavored yogurt. And then now for dinner, you still have your proteins, will be a plant protein, animal protein, and vegetables. Remember, every meal will need to have a vegetable in it. You can have your unprocessed carbohydrates, but very little carbohydrates, especially over dinner time.
What are some practical tips for portion control and avoiding overeating?
Some tips for portion control and avoiding overeating. One, get a smaller plate for food, half of what you actually serve with. And for some people will be get a side plate and portion that. The other thing will be to get already portioned out plates, where you actually have a specific area to put your vegetables, a specific area to put your carbohydrates and your protein. The other way to measure your portions is stop eating when you have full. Okay, you don't have to fill yourself. Stop eating when you have full. The other pretty good way is to take water before your meal and also in between your meals, and that actually makes you full quite often. So an example of a portion plate will be these, where it's portioned into three, the largest part being for the vegetables, where you put in your vegetables, and then the smaller part will be to put in your starch, And also the other portion will be to put in your proteins. So this is a good example of portioning your food, and also get a smaller plate if you're looking to decrease your portions.
How can consulting a registered dietitian benefit individuals with diabetes?
Diabetologists work very closely with nutritionists or dietitians, and this is because nutrition forms the basis of diabetes and the cornerstone of it. And so we'd recommend the first visit that you do to a diabetologist will be to see also a nutritionist at the same sitting, and this really allays the nutrition aspect together with the medical management that you're going to be told.
Are there specific foods or ingredients that people with diabetes should avoid?
So there are no foods to avoid when you have diabetes. The only big thing to avoid will be processed sugar. And this is sugar in your tea, soft drinks, sodas. So that is key because that will spike your glucose, and that is what we don't want in diabetes. The other foods to avoid will be processed carbohydrates, and these include the white carbohydrates. So your white chapati, white bread, and any other processed form of carbohydrate. So we opt that you go for the unprocessed foods, the whole grain foods, and other forms of carbohydrate. This awareness month, we want to bring awareness to diabetes. One, for nutrition, eat well and eat properly, as we've talked about, and this helps to prevent diabetes. But should you be found to have diabetes, then this is a quick guide for nutrition on what you should eat. Thank you for watching, and see you next time.